Good evening, everybody. Colin Leask here. I've got a great honour tonight to introduce Dr. Jenny Crosby from the US of A. Um, I'm not going to take any more of her time up, and I'll get straight into Jenny, who's speaking on breast cancer prevention tonight. Jenny, over to you. Thank you very much.
Hi, good evening. I have been in practice for about 20 years, and a little more than that actually. And over the course of this time, there have been several things that have become near and dear to my heart, and female health issues being a component of that. So tonight I'm touching on breast cancer and breast cancer prevention. We'll just follow through here with the slides. Okay, so breast cancer accounts for almost a third of the total cancer diagnosis in women in the European region, according to the World Health Organization. And from the 1950s until the 1980s, the rate of breast cancer rose virtually everywhere in Europe except Norway and Sweden. Taking the entire European region as a whole, deaths from breast cancer peaked in the 1990s, with almost 15 deaths per 100,000 people, and it peaked in 1994, falling to 13 lives per 100,000 in 2009. Unfortunately, breast cancer is usually diagnosed at an advanced stage, and by advanced we mean stage 3, where it is in lymph nodes and proliferating and a little harder to contain. Evidence from high-income countries, however, indicates that with screening with mammography, you can reduce the mortality from breast cancer. As long as the screening programs are there, the infrastructure is there. So higher-income countries in the EU will have a better opportunity for this, obviously, than some of those who are less able to develop the infrastructures. When you have a well-organized program of mammography, you can actually reduce breast cancer mortality by at least 20% in women over the age of 50, and that's pretty substantial. Currently, most countries in the EU are setting up population-based screening programs for breast cancer prevention, and or breast cancer identification in earlier stages. And getting involved with this, actually getting in, asking your doctor for a screening exam, and trying to do that at least every couple of years is prudent. And then if you've got a health history that makes you higher risk for breast cancer, trying to encourage your doctor to do it once a year is also beneficial. From 1989 to 2006, we had this decrease in mortality in many countries, although overall the amount of breast cancer remained stable or even increased in Central Europe. And there were big reductions in some countries, like Iceland, where they reduced it almost 50%, and then a massive increase in Romania as they, I guess, as they came on board with more income and a more, I call it a North American diet, a lot more white food, a lot more junk food, a lot more access to things that are less healthful. Okay, so some of the biggest decreases also occurred in the 90s in England, Wales, Scotland, Ireland, Sweden, France, and Finland. And I'm going to touch on why that is in a couple of minutes. But in contrast, around the Mediterranean, Eastern Europe, we saw no visible decrease in rates. Now, after a 20-year increase in the US through the 1980s and through the 1990s, we started to see decreasing rates of breast cancer here too. And it dropped very sharply in the early 2000s. And we see this in all high-income countries, whether it's Canada, the United States, the UK, France, Germany, it doesn't really matter. But this increase that occurred through the 80s and into the 90s, and then the subsequent decrease that occurred, were kind of mirrored on both sides of the ocean. And the principal reason for it was the abrupt decline in use of hormone replacement therapy. As you might be aware, hormone replacement therapy has been used for menopausal women to help mitigate or minimize their hot flashes and other postmenopausal symptoms. And so routinely in the 80s, 90s, early 90s in particular, it was being prescribed to women for symptoms of postmenopause, but also it was being marketed as a way to prevent them from having heart attack, which, interestingly enough, there was absolutely no literature to support. Doctors stopped prescribing hormone replacement therapy as a result of a highly publicized link between the use of it and an increased risk of breast cancer and an increased risk of heart disease. In fact, the Women's Health Initiative looked at a longitudinal study of nurses, and they actually discontinued the study because of a significant increase in heart attacks in the women on hormone replacement therapy. So hormone replacement therapy, which was being promoted to doctors in all first world countries, literally became, it was discovered that it really wasn't protecting women from heart health issues, but it was actually creating them. And so overnight, doctors shifted away from using hormone replacement therapy, and the cancer trends in these higher income countries started to go down. What we learned from that is changing what the medical community and what society considered standard practice can cause sudden shifts in cancer risk. Now, there are some risks you can't avoid when it comes to breast cancer. You can't avoid being born female. You can't avoid being born with the BRCA gene, the BRCA gene. This gene, unfortunately, gives you almost a 50 to 85% risk of developing breast cancer by age 70. So it greatly enhances your risk of developing breast cancer. And a 40 to 60% risk of developing ovarian cancer by age 85. So these are completely unavoidable risks for breast cancer. Getting older, you can't avoid that. We do know that 1 out of 8 invasive breast cancers happens in women younger than 45, but 2 out of 3 of them occur in women over 55. So age is yet another unavoidable risk factor. If there's a personal or family history of breast cancer, a first-degree relative such as a mother, a sister, a daughter, then your risk is doubled. If you have 2 immediate relatives with breast cancer, it triples your risk. Now, if you've not been getting mammography and you have mothers, sisters, daughters with breast cancer, then this would be one of those things that I would be running to your primary health care provider to ensure happens. Getting those mammograms on a regular basis enables you to catch it when it's stage 1, stage 2, rather than waiting until it's stage 3. Dense breasts are another unavoidable risk factor. Some women have a higher density tissue, and that higher density tissue has a propensity